Hey everyone, welcome. This is the Tinnitus Virtual Summit 2020. My name is Dr. Ben Thompson, audiologist and tinnitus specialist in California. We are here today with a special guest all the way from Minnesota in the United States. This is Dr. John Coverstone, who is an audiologist in Minnesota. John regularly writes for Tinnitus Today, the magazine for the American Tinnitus Association, and he co-hosts the ATA's podcast Conversations in Tinnitus. He also co-hosts an audiology podcast, Audiology Talk. So, Dr. Coverstone, I wanted to ask you first, how have you seen COVID-19 affect the audiology and tinnitus communities?
Well, as audiologists, first of all, of course, we're already in clinical practice. A lot of the procedures that the general public is learning about over the last few months, we do routinely in the clinic anyway. And I've talked with many colleagues, audiologists and other professions, optometrists, physicians, dentists, and we're all stepping up our efforts. But a lot of the things that people are learning to do regularly, we've been doing regularly for our entire careers. Being a disease that we have to pay particular attention to simply because of the fact that while it's not extremely virulent compared to others, it is something our immune system hasn't seen before, so we do need some extra protection to try to slow down that transmission. It's very easily transmittable, and so we are doing things such as making longer appointments so that we don't have patients overlapping in the office. Some people are going as far as preventing people from coming inside the office until it's their appointment time. So they may even be keeping the door locked with the sign that lets you know to please queue outside or stay in your car and then come in when it's time. So we're trying to keep people from being in contact with each other, as well as keep ourselves safe. So you'll go into most clinics nowadays, as well as retail locations, restaurants, and other places as they open, and find people wearing masks, wearing gloves, keeping themselves safe. In terms of tinnitus itself, I don't think we have a lot of real good links in COVID-19 particularly, other than the fact that it is a disease. It's a virus, of course, and antivirals, by and large, don't have a significant effect on tinnitus, although there are certain drugs that can be given that may have an effect on tinnitus. Anything with quinine poses that risk at certain doses. And so, of course, we have to be aware of that and make sure that we're monitoring people if we have the opportunity to do so. Some people who are hospitalized may actually come down with a bacterial infection if their case gets real severe. And if they're given systemic drugs that are in certain families, those also can be damaging to the hearing and balance system and cause tinnitus. And so those are fewer cases by far, but there are other things we need to pay attention to, and those are more secondary effects, of course.
Thanks, John. Yeah, this is definitely a time where the leaders in the field and anyone who's managing a clinic or an in-person service is taking a step back, trying to strategize and plan this for the long term, because we need to provide services to our communities, to our patients. So how can we do that in a safe way while also giving people access to hearing healthcare? That's the golden question. I wanted to ask you a few questions about your podcast, Conversations in Tinnitus.
Sure.
And I believe there's around 13 total episodes for that particular podcast. And I wanted to ask, what were some of the most memorable conversations you've had in your podcast, Conversations in Tinnitus?
Gosh, we've had many because we've just had some fantastic guests on. I would say Dean Flieger and myself, my co-host and myself, have exponentially increased our knowledge of neurophysiology with tinnitus. We've had a number of neuroscientists on and other researchers in the area of tinnitus, and we've learned a lot, even though we were already pretty proficient with tinnitus diagnostics and care. But I think one of the messages we've taken away is that tinnitus is not a single target, and we're not going to find a single cure for it. And that's one thing that he and I agree strongly upon. And most of the neuroscientists I've talked to and had this conversation with also agree on this, that tinnitus is probably not caused by one thing in one part of the brain. We are seeing successes with people targeting some of the auditory nerve, which is one of the lower parts of the lowest part of the auditory nervous system. We are seeing some successes with people targeting areas of the brain stem, and even with some successes with people targeting areas of the cortex, some of the mechanisms that may decide what stimuli are perceived by the brain and what stimuli are filtered out. And when those are impaired, some people seem to have tinnitus, and targeting those areas for treatment seem to make it better. So I think what we're really learning more than anything else at this point is that there probably is not going to be one single cure for tinnitus. We do hope we start finding some cures, and there definitely are some promising things coming out, some multifaceted, or what we would call multimodal approaches. So there is a device one company is coming out with based on research out of the University of Michigan and elsewhere that uses a two-mode approach to try to kind of reset some of the structures in the brain and alleviate the tinnitus. And so we're seeing things like that come out, but I don't think there's going to ever be a single one. And that's going to fall back on us as providers to appropriately diagnose the type of tinnitus that you have once the tools emerge to do that, and then find the appropriate treatment for you.
And what advice would you have for someone who's watching, who has tinnitus, who wants to be on the cutting edge of when these research projects are released, and they may be interested in a clinical trial or something of that sort? Do you have any advice for someone in our audience who may be in that position?
Most of the clinical trials are either going to be in one site or multiple sites, but drawing from their communities in those areas. There may be some clinical trials that are wider spread. Maybe they have something that's more portable and doesn't necessarily need someone to be working with you closely, or could be worked with remotely, but most of them would be kind of localized. And so you'd want to look for clinical trials in your area. So if you live in Oregon and someone's doing a clinical trial in Massachusetts, you're probably not going to be a candidate for that one. But there may be somebody in Oregon who's doing it, or they may be a site for that. So it just kind of depends on how it's being run. And in terms of staying up, the research is coming out constantly. On my more generic audiology podcast called Audiology Talk, we joke sometimes that we almost never have an episode without talking about tinnitus, because there's so much research coming out on tinnitus. The British Tinnitus Association a couple of years ago released a publication which was a review of literature. And so this is an area that's getting more attention, getting more funding. And so there is a lot of new stuff coming out all the time, and there are multiple places to find out about that. Certainly our podcast is one. The American Tinnitus Association does a wonderful job in their website at ata.org, and also in their publication for members, Tinnitus Today, of bringing that research to people and making it available so that you can keep up on what we believe are some of the more relevant pieces of research toward finding a cure and toward helping people that have tinnitus.
Thank you for that. And yeah, as a podcast host, you're not only sharing the presenters and speakers' message to your audience, but you're also learning so much, like you just shared. And on the management side of tinnitus, because right now there is no cure for most kinds of tinnitus. So what have you learned and what have you gathered from having these guests on talking about different ways to manage tinnitus?
Well, for one thing, it's very individualized. That initial appointment, or the initial couple of appointments, are just critical to someone with tinnitus, because part of our job, the biggest part of our job during those initial appointments, is to figure out why you have this tinnitus, if possible, and that's not always possible, and why it's a bother for you. Because there have been studies in the past that have shown that we can take the same group of subjects, of people, and split them into groups where it's bothersome or not bothersome, and pair them according to the sound, loudness of the tinnitus, characteristics such as that. So you can have matched groups with the same tinnitus, but half of them aren't bothered by it and half of them are. And what that's taught us over the years is that there's a very strong psychological component to tinnitus. Doesn't mean you're crazy because you have bothersome tinnitus, but it's very often accompanied by stress, anxiety, psychological, psychiatric disorders. And so we've learned to look at those, and counseling has become a significant part of tinnitus treatment. And in fact, if you look through the literature, you'll find that tinnitus reviews, the most prominent of those are from the American Academy of Audiology, who published a review about 4 or 5 years ago. They found that cognitive behavioral therapy, which is a psychological treatment, counseling treatment, was the only thing that had significant literature to prove its effectiveness. And I'm not sure that's really changed a whole lot today. We are starting to see some other things come out which are showing effective. Many of the treatments that are out there, the devices and the sounds that you can get and such, are basically equivalent. And in fact, I'm not sure any of them have been shown to be beneficial over each other. And that includes just generic things like white noise. I often talk to patients and tell them whatever sound is acceptable to you, use it. We used to tell people white noise or broadband noise was kind of the key thing. We're starting to see more evidence come out that particular noise isn't as important. It's just whatever noise can help bring down the relative loudness of that tinnitus and help you with it. And so on the sound therapy side, that's important. And whatever works for you, honestly, is what we recommend.
And John, could you please tell us what is something new that you've learned about tinnitus in the past year?
I might have to go a little farther back than a year, because one of the things that I have tuned in to in the last couple of years has been pediatric tinnitus. That's really been one of the newest revelations for me. And my first eye-opening event was with someone, just talking casually with someone who has written a couple books and has a blog on tinnitus and Meniere's disease. And he made the comment to me that he is now probably in his early mid-30s. He made the comment to me that he's always heard this sound since he was a kid. But when he got Meniere's disease, it got much worse. And we were having that conversation, the two of us, and I kind of stopped him at that point and said, wait, hold on a second. You heard this when you were a child? Because I had never had someone say that to me before. And so it led to a whole conversation about that. And shortly after that, talk about good timing, a lot of the research that's come out in the UK, most notably by David Bagley and Claire Benton and some others in the Nottingham area, have shown us that the prevalence of tinnitus in children is significant. Their data has shown us that about 1 in 3 children will experience tinnitus in some form during their childhood, and about 1 in 30 will have bothersome tinnitus, to where it does actually affect them, may affect their learning in the classroom and such. And that's almost 1 child per classroom, if you extrapolate that out. And that's a huge number. That's very significant. And so I have started to uncover, now that I know to look for it, I look for it, and I'm finding it, of course, and you know how that works. And I'm starting to uncover more cases in my area. I do work with a number of schools, quite a few schools in Minnesota, and I have come across some kids that have these kind of complex problems listening and hearing. And I've asked many of them, I pretty routinely now ask, do you ever hear sounds even when it's quiet? And some of them said, yes, I hear these sounds. And so then we've got something we can address. And often the parents are shocked because it's not something anyone else has ever thought of. And so it's an area that I'm hoping both we as a professional community and the public at large will tune into more and learn about more, and then we'll raise awareness and let people know that this does happen. Let teachers and schools know, let parents know that this is a thing and it is happening out there, and there are things we can do about it. But first we have to know that it exists. And so that's a message that I've been trying to get out.
Yeah, I did see that on some of your materials about tinnitus in the pediatric population. And in my own experience, I remember a specific case where there was a teenager who had a sudden hearing loss and had stress and anxiety associated with their tinnitus. And in that position, with the child, with the parent, it becomes a whole team approach, right? With the school, the audiologist, potentially a social worker or a school therapist. Have you encountered further steps with certain cases in that regard?
The few that I have so far have been fairly mild, so thank goodness for that, for their sake. But there are a number of things that we can do with them. Sometimes it just helps the child to understand what this is, and it's something they've often been living with. And if it's bothersome, we may need to look at some sound therapy. We may need to work with the school to let them know that this is something that's truly needed for the child. Sound therapy is often in the form of hearing aids for us in the audiology world, although it can be done through earbuds and such. But we need to, with a child, of course, just like any other pediatric concern, they're not just small adults. They have very different needs and very different concerns. And so we have to make sure we assess all those in their different listening environments. And just as an adult, they have their own unique listening environment, school and home and playground and local park and things such as that. And so we have to see how we can address that in those different situations and help them. And sometimes, to go back to the psychological part, sometimes it's just a matter of kind of demystifying it and helping them to understand what's going on and that it's okay, that actually quite a few people hear this and they don't need to be frightened of it, as some children are, especially when it is more severe, and just alleviate those concerns. And that alone can help them quite a bit as well.
Yeah, thank you, John. And we're wrapping up here with our interview with Dr. John Coverstone for the Tinnitus Virtual Summit 2020. John, where can we find your work? Where can our audience follow you with your podcasts?
Well, the Conversations in Tinnitus podcast, of course, is available through the ata.org website. And so you can go there and download those podcasts and subscribe to the podcast so that it's automatically downloaded to your device. Audiology Talk is a podcast that's really targeted towards audiologists, and we get into a lot of research and professional issues, things like that. So we don't really target it towards the general public, but if we have some audiologists watching that would like to subscribe, then you can go to audiologytalk.org. We are also on the various feeds that are out there, Google and Apple and so iTunes and things like that. And so they can be usually found on most devices just by doing a search on those. And then, of course, Tinnitus Today is a publication from the American Tinnitus Association. It is a paper publication, bound magazine, and that is mailed out to members of the organization. And if you are all sympathetic to the issue of tinnitus and tinnitus care, which I imagine if you're watching this, you would be, I would certainly just put out there, I hope you'll consider donating to the organization in your area. There are many good organizations around the country. So I work with ATA because I'm in the United States, but the British Tinnitus Association is absolutely wonderful over in England. And there are other organizations too. And so I hope you'll consider supporting them and becoming a member.
John, thank you so much. My name is Dr. Ben Thompson. This is the Tinnitus Virtual Summit 2020. Thanks to everyone for viewing. Make sure you catch all of our other interviews and presentations in the summit, and be safe. Take care.